Now, moving forward, Afghanistan is now faced with medicine shortage due to disrupted border crossings and limited operation of banks. This comes after the Taliban takeover and disruption of the normal operations. The shortage has been brought about due to limited bank operations, and despite talks by Afghan authorities, their efforts are proving futile. Patricia Waigwa reports.
Almost all medicine in Afghanistan is imported from neighboring countries such as Pakistan, India, Bangladesh, Iran, and Turkey. However, the border crossings between Afghanistan and its neighbors were disrupted in the lead up to the Taliban takeover, and normal operations are yet to resume. But worse still, wholesalers have been unable to complete transactions due to the limited operation of banks.
Yes, since the takeover, banks are closed for international transactions. As the banks are closed, we can't transfer payments to suppliers. If we don't transfer money to the suppliers legally, they will not be able to deliver us the medicine and prices will definitely rise. When demand is high and supply is low, the prices naturally go up. We are facing a shortage in supply of essential medicine.
Officials say the number of visitors at government hospitals have increased since the change of the regime. The good news is that international donors have increased their focus towards government hospitals.
In fact, we have even more visiting patients. Fortunately, we got more attention from UNICEF and the WHO, especially towards our hospital, which is a children's hospital. They didn't have enough focus in the last few years, but in the last month, they increased our medical supply.
Government hospitals were not able to provide medicines to patients despite the continued funding in the previous regime.
On one hand, prices have increased, while on the other hand, the people have become poorer. This has affected the doctors, patients, and society. Even in the former regime, patients used to buy the medicine in the market. We used to prescribe the medicine. Patients were not provided even with a single pill from the hospital.
And it led us having few or no supply in most of our health facilities, including essential medicine, fuel, oxygen, staff salary. We've been trying to work with different stakeholders to see if we can fulfill the urgent needs, but we haven't been able to do it successfully.
Many of the problems in the health sector have been left over the previous regime, where Wahid Mahrour, the acting Minister of Public Health, said the Afghan authorities have tried to solve the issue in coordination with stakeholders, but efforts were unsuccessful. Patricia Waigwa, Switch TV.